Hi, I'm Dr. Fred Wilder. I am a board-certified plastic surgeon. So every operation has the potential for complications. Fortunately, most of the time, those complications are relatively rare and uncommon. Most complications happen with a frequency of 1 in 100 or less. One of the exceptions is what happens to breast implants following augmentation with this thing called encapsulation. Well, what is encapsulation? Anytime you put a foreign device, a foreign body, in a human body, the body is going to try to wall that off with scar tissue. Whether it's a pacemaker being put in or a knee implant being put in, the body is going to form scar tissue around that. Now, devices that are hard, like pacemakers and knee implants, you can't really tell if the scar tissue that's around that implant is causing problems. But with a breast implant, which is supposed to be soft like a natural breast, what oftentimes happens is that the capsule that your body makes, and we can't script what your body's going to do. Some women encapsulate, some women don't. And the encapsulation rate probably and realistically is somewhere between 5 and 10%, which is relatively high, but not as high as the 50% that happened when implants were first invented in the 1960s. So what can we do to minimize that? Well, one very common thing that most plastic surgeons do is that we put these implants under the pectoralis major muscle. And we know that that greatly reduces the encapsulation rate. The other thing that we will oftentimes do, in addition obviously to using very strict and sterile technique, trying to avoid bleeding, trying to avoid swelling, trying to avoid tissue trauma. So technique is very important, but the other thing that we do is we make the space for the implant somewhat bigger than the implant itself. And that gives the implant some wiggle room. In order to maintain that space, we have to teach patients how to move their implants around, which we usually do a day or two following surgery. And that way, even if that capsule shrinks a little bit, as long as it stays larger than the implant and doesn't squeeze on the implant, the breast will usually remain soft. But unfortunately, encapsulation is one of those things that happens. We do have some medications now that are off-label use medications that can help when we catch an encapsulation early, and I will oftentimes recommend using that when we do revisions for women who have encapsulated, because if an encapsulation becomes set, then there is no solution to that other than going back in and either scoring and releasing, enlarging that space, and if the capsule has become very thick, sometimes with older implants we will see capsules that are very thick and sometimes even calcified like an eggshell. In those cases, the entire capsule needs to be removed, and then we start over in a new space, and the hope is that the patient will not encapsulate the second time. But encapsulation is always the biggest risk that we face with implants.